Hello, HEA 426 cohort. We want to present to you Competency 5, Administer and Manage Health Education. Now, I know a lot of you guys are wondering, how does leadership and management relate to public health education and being a health educator? And our goal is to help you grow within our competency. Health education specialists are broadly trained to work as system thinkers with individuals, groups, and communities, and as a result, they can function effectively in multiple results within the larger context of their institution or other environments. The boundaries between the entry and advanced levels become permeable when communities, groups, or organizations have roles to fill with few individuals are well trained and credentialed. While some administrative functions may fall to the entry level, health education specialist administration is generally a function of the more advanced level individual. Health education specialists often become program managers or supervisors of other health education specialists or teams of allied health professionals. Good management incorporates effective leadership skills with managing fiscal resources, task assignments, and performance evaluation. Supervisors obtain acceptance and support for programs from stakeholders such as higher level management or staff. This role requires effective communication skills, organizational knowledge, and objectivity. Because of their broad training and their understanding of individuals and communities, health education specialists can be effective managers who consider potential partnerships in the larger context of their institution or environment. Our first subcompetency is 5.1, Manage Fiscal Resources. Some skills that a health educator should have when developing within this subcompetency is writing, administering and managing health education, and completing funding searches. Writing and submitting grants, budgeting money, and managing resources are also skills that are developed within this competency. Managing fiscal resources is an advanced level job due to it being very time consuming and having tons of education. Our second subcompetency is 5.2, which is obtain acceptance and support for programs. Obtaining acceptance and support from programs has become an important role for health education specialists. By programs requiring support and acceptance, it helps to ensure that stakeholders are involved from the beginning to the end. Having that support from stakeholders will signify that necessary resources, human and fiscal, are available to maintain the program's strengths and able to address the program's weaknesses. Health education specialists periodically work close with supporters to identify ways to sustain programs beyond the project period. Our third subcompetency is demonstrate leadership. Health education specialists are required to exercise leadership in different situations, settings, and environment. Leadership can be defined as the ability to exercise and influence both formally and informally in ways that facilitate positive and effective outcomes. As a health education specialist, you should be able to represent the ideal image and show organizational leadership. Our fourth subcompetency is manage human resources. Effective management of human resources requires good planning and coordination of the administrative functions of an organization. Good management of human resources incorporates good leadership skills with managing of human resources, which might require managing coalitions, facilitating community-based initiatives, and forming interagency collaborations. Health educators ensure volunteers and those working with them understand their task and also ensure that appropriate tasks are given to the suitable staff members. Our last subcompetency is 5.5, which is facilitate partnerships in support of health education. As a certified health educator, it is important to work with other agencies and organizations in order to create effective partnerships, coalitions, and collaborations. The ability to facilitate and communicate skillfully with community partners will allow for the delivery and support of health education. Knowledge of planning, implementation, and evaluation will allow for the health educator to be successful at managing the partnership process. Thank you for listening, and this concludes our summary of Competency 5, Administer and Manage Health Education.